We're here in Istanbul. There's a bunch of different parts of the DeSci community. There as like DAOs and IPNFTs and other kind of decentralized science tools continue to be explored to address gaps in scientific research, improve the efficiencies of research, product development, et cetera. There's a growing realization that uh, sooner or later, that these DeSci initiatives are going to have to, they're going to want to, and some are already, connect with legacy health innovation institutions, whether they're regulators who might approve, new protocols of treatment or products based on patient research community DAO gather data, or taking leveraging real world evidence that's collected in some decentralized way to have a streamlined trial design and so forth. So I have you three helping us kind of set the tone of the day long kind of workshops. I'm going to ask Jose a few questions first, and then Jose, I know you've got a very early flight to DC tomorrow morning, so feel free to hop off if you need to right after a few of these questions. And then Dr. Cahana and Dr. Sehgal and I'll sort of continue the conversation. But for everyone in the room here, it's a great honor to have Jose Arrieta, Alex Cahana, and Neil Sehgal here. I'll give Neil and Alex's backgrounds in a little bit, but Jose was CIO and Chief Data Officer of HHS, probably in the most crucial moment of that agency's history in the U.S., and also held a variety of government posts beforehand that were purchased, from which he led the development of and the implementation of the first government authorized uses of blockchain technology. So I'm going to start off, Jose, asking you, briefly to kind of summarize, maybe 5 minutes or so, the short Cliff Notes version of what HHS Accelerate, why you did that and how you did that, and how that led into launching HHS Protect. And then we'll follow up with a couple questions about lessons learned that might be applicable to DeSci.
No, Roger. Well, first of all, it's an honor to be with you guys virtually. Jason and David, big congratulations to all the success you've had with Remedy. I love seeing your success, and great to see you guys again. I'll talk a little bit about kind of the purpose of HHS Accelerate, and then maybe how it led to HHS Protect. If you think about the Department of Health and Human Services in the United States, it does $1 trillion in grants a year, about $2 trillion in payments, and about 26 billion in contracts. And when you think about the total number of endpoints, whether it's an industry partner or a grant recipient that you're engaging with, you're looking at over 50,000 different points of engagement in 164 countries. And one of the things from a contracting perspective that we wanted to do is we wanted to create a visibility into prices paid and terms and conditions. And so our concept is if we looked at each industry partner as a wallet, then one of the things that we could do with that industry partner is we could create a representation of them, the terms and conditions that they offered within their contracts, the prices that they offered products or services to us for, and then we could use that identifier for one individual company across the entirety of our portfolio. And to give you an example, I think Deloitte had over $800 million in contracts with us, and there were probably over 10,000 direct contracts with Deloitte. So now I could look at the Deloitte portfolio. Deloitte had a single identity. I could pack all that data into a wallet, and then I could unpack their terms and conditions and pricing around services. And so we were running a recurrent neural network to actually analyze that off of the blockchain itself. The other thing that we wanted to do, and I'll give you an example in products, I think we were spending, if memory serves, close to $1 billion a year with VMware. So we were able to look at the pricing for different products that VMware offered, the terms and conditions, and we identified about $270 million in savings over a 10-year period of time. that we were able to negotiate with VMware because we had visibility into the prices paid in terms and conditions. So what we wanted to do is we wanted to create a decentralized network where we could build a wallet around an industry partner and actually run things like, in this case, a recurrent neural network off of the data assets so that we could create a representation of prices paid across the portfolio as it related to terms and conditions. Now, the other piece of it from a contracting perspective, and it's kind of the same for grants, but the other piece of it from a contracting perspective is we want to push that data to the lowest level in the organization so that decisions could be made rapidly with full information to award a contract. And then the last thing is the secretary of the agency, right, overseeing 2 trillion in payments, a trillion in grants, 27 billion in contracts, really should be able to drill down to the lowest level in the organization and have an understanding in real time as to a price point of a product, a price point of a set of services, and the identity of the vendor that was providing that. Now, on the flip side of that, and I'll just use this one example, we did the same thing in grants. We did the same thing both in grants and contracting. We applied the same principles, just to different outcomes. But I give you a different look at it in the grants portfolio. One of the challenges we had when you looked at something like the grant portfolio is we knew how much money we put into fighting the opioids epidemic. We didn't know how effective it was. All right, so we knew that we maybe put $1 billion into grants for people that had plans to fight opioids, but we didn't have an ability to take that amount that was paid to that endpoint, that recipient of the grant, and then the plan that they were stating that they would implement, and actually bring the outcomes and the grant dollars that were expended together. And so again, what we did is we used the nodes in the blockchain-based ecosystem to actually create a wallet around the endpoint who received the grant, and then we created APIs and we started to score data assets that came from existing systems within our network, so that we had a representation, a rapid representation of the amount of cash outflow to opioids and the impact that it may have had, and we could do that in real time. And our concept was that once we created this connectivity, we would have an audit trail of dollars that went out. We would have an audit trail of impact, right? Because we wanted to understand the impact that we were having. And then we would create a more robust visibility into kind of performance. So that was the first 2 implementations of blockchain on the federal side. I just gave you 2 examples of how we were using it. But it was to provide detail at the lowest level in the organization so decision making could be more accurate. It was to provide an audit trail on both sides of the equation so execution could be more efficient. And it was to create visibility so that we could understand impact. Now, I was the CIO, Chief Data Officer of HHS during the pandemic in the United States. And probably like every other country in the world, we had a COVID tracker that ran on every news station, and it counted death rates and case counts across the nation. And if you saw it in the United States, it would tell you that Johns Hopkins University had analyzed case counts and death rates in the United States, and it would give you their numbers. But the reality of the COVID data was we had no visibility in the United States as to what was happening around March of 2020. So what my team and I did is we connected all 50 states, all 6 territories, all the nursing homes, hospitals, and 8,000 counties. We connected the data assets from all of those locations, probably 450 different data sets. And we started to bring them all together to create visibility into what was happening across the United States. How is the pathogen changing at a zip code level? What is the spread of cases? And we're taking that data and making it visible in counties, in cities, at the state level. I'll just be super honest with you because there's a whole Bloomberg documentary coming out on this next Tuesday, so might as well not hide anything. It's actually coming out on some cyber attacks, but one of the challenges you have in an election year when you're aggregating data like that, and the center of the election is COVID-19. As you have people that misconstrue the numbers. So I'm going to give you a couple examples, and I'm not going to tell you the location or the person. All right. So in the part of the United States near where Dave and Jason live, we had a governor who stated that they weren't receiving enough therapeutics to meet the demand of the state that he operated in, that he governed. In reality, because we had built a blockchain into this ecosystem, but he had warned us through a letter to President Trump that he was going to make this information public. By the way, this happened on both sides of the aisle, Democrat and Republican. So he had warned us that he was going to make this information public, and I just happened to know the Secretary of Health in that state from years ago, working in a national security space. So I called the secretary and I said, we have a record. I can release the log files of someone in your state taking the data assets and submitting the same data assets twice within 2 minutes of each submission. So I know you're saying that you didn't get enough remdesivir, but in reality, the reason the numbers are skewed is because someone on your end submitted the same data set twice. And we had built some AI into our ecosystem so we could rationalize out double submissions. And so your claim is false. And if you go public with it, we have to release the log files. We have to release that to the American public. Now we had another example. This is from the other side of the aisle, in a state where the governor actually went on Fox News and said, don't trust data. Don't trust the COVID case count. It's all false. And his assertion was that in his state, there were only, I'm making up the numbers, so you can't Google it, by the way. There were only 200 functioning hospitals. And therefore, we used the hospital number as a denominator to determine different things: remdesivir distribution, case spread rate, the number of masks that we would provide at a given level in any county. And so he wasn't receiving the things that he needed to receive in order to successfully protect the people in his state. So he said, hey, there's only 200 functioning hospitals. Well, we had created an identity for every single data source that we received across the entire United States. And we politely went back to that governor and said, you may have only identified 200 hospitals in your state, but there's actually 230 functioning, because the 30 hospital, and they came back and said those 30 hospitals are closed. Well, the 30 hospitals that you state are closed are submitting data to us every single day via an active API that we set up. And I've never met an institution that wants to be regulated after it's closed. I've never met an institution that wants to be regulated when it's open. So, during the pandemic, the blockchain became an ability to create an identity for every endpoint that we were receiving data from. We created an audit trail, or a record of provenance of each data asset that we received that was time-stamped. Any curate, parse activity that we engaged in when we received those data assets was actually recorded on the blockchain. And then as people were building models and slide decks to actually give presentations on the impact of COVID-19 on their state, we were actually watermarking those data assets so that we knew when they actually pulled the data. Because one of the challenges you have when you have kind of a distributed democratic society like we have here in the United States is you can build a presentation to show the impact of COVID-19, but if you built that presentation on yesterday's data versus today's data, it may not be as accurate. And it may portray a different message. And in an election year, that becomes very important. By the way, I had the worst job that you could ever have. I mean, I don't regret it, but I aged like 25 years during this time. The other really kind of fascinating thing about the blockchain, right? And so one of the things that we started to be able to see is behavior of hospital systems, behavior of state hospital systems. And we could start to see who was overworked. when you've created an identity around any endpoint that submits data to you, and I refer to it that way, not to be mechanical, but we had states that were submitting data to us. We had individual hospitals that were submitting data to us, but they were also submitting data to the states themselves, and we had to rationalize and kind of pull that out. When you create an identity for every data asset, when you create an identity for every uh, partner that's actually providing you data, you start to be able to understand behaviors. And so some of the behaviors that we were able to identify are things like places where the hospital system itself was overworked, where the public health community was really only submitting data once a week, and we were seeing large spikes in case counts and death rates, sometimes on Sundays and sometimes on Wednesdays. And that wasn't a reflection of any activity in the environment. That was a reflection of their lack of resources to actually input the data. The other really interesting, I'll just throw out a couple trends here and then I'll stop. Some of the other really interesting, and you need provenance, you need an understanding of when things were curated, when things were parsed, when things were ingested, in order to be, and where, and the identity of where the data assets actually came from. Because you're running supervised machine learning on those data assets. So we did the largest implementation of supervised machine learning in the history of the world. And what we were doing is we were trying to predict outbreaks across the United States. We were trying to speed up clinical trials because we wanted to get to a vaccine as quickly as possible. And we were trying to figure out how to distribute remdesivir. And one of the fascinating things in public health in the United States, and Jason could probably talk about this in a ton more detail, is that people don't function within a state itself. And what I mean by that is there's regional hubs where health outcomes are delivered for people. And many times that involves individuals in one state crossing a border to another state to receive service. And when you think about giving aid and providing aid, to a population of 330 million people that are distributed across a vast kind of area, it becomes really important to know where they're actually going to receive services. And one of the things that you can do when you're collecting data and when you're creating an identity from the endpoint that's receiving it, and you're doing parsing, curating, and stamping of data on a chain itself, is you can start to become very predictive of what's driving that behavior and what's happening. And the blockchain becomes very important to that because you start to receive a lot of pushback from people because they may not have visibility or understanding into what's happening, and you need a rapid record audit trail that you can document and show how you achieve that outcome. And it gives you the ability to take it a step further, and I won't get into a ton of details on this, but I'll just say, we could predict the impact of hospital closures. We could see hospital closures coming in real time because of some of the data assets we were pulling. We could be predictive when it came to food deserts. We created almost the functioning equivalent of a hedge fund, which we never talk about this publicly, and I guess I understand why now, but it's been a couple of years, so I'll just say it. We created the functioning equivalent of a hedge fund in the environment because I wanted to be predictive about food deserts. I wanted to be predictive about hospital closures. Then you say, why? Well, if you go into any suburban town in the US, you're going to see an American flag over the police station. Probably going to see a McDonald's. You're going to see a school, and you're going to see a hospital. And then the four biggest employers. And three of them are probably the biggest employers with the higher paying jobs, the hospital being the largest. And when a hospital shuts down, it has a huge impact on small and medium-sized communities, rural and even small suburban communities. And those are the people that are most in need, right? So having a record of provenance, having time-stamped ability to understand changes in data, and then knowing how that data is curated in an election year when you're pushing capital out to those communities so that they can kind of survive this punch in the stomach that they're receiving from COVID-19 becomes very important, both in making the right decision and defending the decision that you ultimately made. So I'll pause there, Jason, and maybe take any questions, but that's how we used blockchain technology And there's a Forbes article on it someplace during the global pandemic.
Thanks so much, Jose. That's those fascinating insights throughout the stories. I think for me, one of the more interesting aspects, given today's focus on sort of compliance and standards for DeSci to scale its impact, is one your story because of the the time stamping, the provenance tracking, the identity management around every single data endpoint. It's a compliance story, but it's not one. It's not the boring kind of static compliance like these are the rules you got to follow. It's one where compliance and standards exist in a dynamic ecosystem where everyone has an agenda. And so what that means, I think, for the DeSci community is there's lessons in what you described, not just in terms of, okay, if you want regulators to trust data coming out of a research DAO or whatever, but it's got implications for decentralized, to the extent that you called out the challenges of a democracy, and the ethos of DeSci is let's democratize science, right? And a research DAO may have an ecosystem of sub-DAO spokes that are each, crowdsourcing data in various ways, and technical standards that potentially make referenceable and verifiable
Yeah.
data quality within a decentralized ecosystem. Like I hear that in your story too, right? So it goes both ways. And this will be this is teeing up for Alex in a second. I'll let you respond to that, and then this is totally Alex's jam too.
I have to kind of jump in here just because, when you're building artificial intelligence off of a data asset, and you know the speed with which you can build a microservice like artificial intelligence these days, knowing what the truth of the data asset is, and that the truth is that geofencing it, the time that it was received, being able to look back at changes as it relates to that data asset becomes extremely important. I'm going to give you an example. I'm on the Navy Science and Technology Board right now, which means I'm setting the Navy Secretary's science and technology strategy, right? And so I'm going to use a COVID-19 example. I want you to imagine ventilators and ventilator usage during COVID-19. Now, you could think of any medical endpoint. Let's imagine that we had a secure root of trust in that ventilator, so nobody could spoof the data coming off of it. We would then know, and this is true, what I'm about to say, we would then know that less time on a ventilator is actually healthier if certain comorbidities don't exist than a longer period of time on a ventilator. We would be able to document that. If that was turned into a political discussion point, and I'm not saying it was, you can Google if you want, and if that was turned into a political discussion point, you'd actually have a hard record of unchanged data as it relates to the performance of that patient on that ventilator. And you would be able to tie it to comorbidities, to any issues that they may have had when they came in and received that type of treatment. And you would understand the impact of that ventilator. You'd be able to build artificial intelligence that could rapidly understand the impact that was having based on those conditions. So it becomes extremely important, right? It's not just boring compliance. It becomes a record of how you made a decision based on the data assets that you were understanding at a given point in time. And it helps you make smarter decisions in the future while keeping you compliant. And I think that's a really important point. Jason, I didn't mean to interrupt you, but the point that you were making, that this isn't boring compliance. Like, this is taking healthcare to another level. And I know Dr. Cahana is going to be all over this. This is taking healthcare to another level if done correctly, but you have to understand and be able to imagine why that's important, because you have a tool now that you didn't have before.
100%. And Jose, just, I understand if you need to hop, feel free to hop at any point. We're going to go on with Alex and Neil for a bit.
No, I'll hang out for a little bit.
Okay, cool. And Alex, I'm going to toss the ball to you. For those in the room who may not know you, Dr. Cahana, after an illustrious career in pain medicine and chair of pain medicine, University of Washington, healthcare up in Seattle, and a variety of different kind of leadership roles in global health policy, U.S. national policy, doing work across Africa and developing countries and strengthening health systems. He became one of the most prominent voices in what became sort of blockchain health and DeSci about 10 years ago. So before even the first Ethereum-based DAO, Dr. Cahana was publishing on Medium. I forget what the initial sort of articulations of what DeSci could be. Before we had IP NFTs, in the discourse, you were calling for all this stuff about 10 years ago. And so I'm really excited to have you here, but wonder, I'll kind of, rather than sort of, throw you a more structured question, just kind of ask for your reflections on what Jose's been sharing and what this means for the emerging DeSci space, where, it's a good thing when you were one of the early voices for what became a movement. And it's a good thing when there's some people, there's a lot of people that know you, but it's a good thing when there's people that don't yet, right? It means it's grown to the point, right, where people are just focused on building and doing things. So Alex, please.
Thank you. Thank you so much for this opportunity. It's true. I think the first piece that I wrote was in 2013, and I looked in horror. What was I writing and thinking of? I think that what's fantastic in Jose's story is that it encapsulates three very important things that we say, but through his story, he actually lived. That one is that centralized systems are security vulnerable, censor vulnerable, and collusion vulnerable. And so when people say, oh, why do we need this centralization? It's messy, democracy is messy, nodes are messy, let's standardize, let's do one size fits all. You forget that these systems can be, by omission or by commission, can be manipulated for whatever, political expediency, for helping the public in its behavior. It doesn't matter, but it does damage the integrity of what we think of as data and the integrity of information. The second, which is really amazing, is that it's unfortunate it's called blockchain, because the fact that the data is in blocks and connected with the chain is irrelevant. It could have been in triangles and circles and whatnot, and it should have been more like a time chain, all going to the Genesis block of where everything was built in 7 days, and there was the knowledge tree and the Merkle trees that followed after that. But the point is that ability to go back to the source is extremely important, and that's why when people ask me, okay, what's the explanation of blockchain? I say it's the software solution to the problem of trust or mistrust, if you wish. Which leads me to the third thing, which is the most important, is that if we try in this post-COVID world to understand what is the problem, basically, multiple problem, what is the problem, not just in healthcare, in everything in this digital world, is I would argue that we've lost this trust. I'm a very optimistic guy. I want to believe everybody, but I don't know what's written on page 47, font 3. I'm not sure I understood everything. Now with generative AI, I don't even know if I'm seeing myself on Zoom or it's something else. But that this problem that we have with trust or mistrust has eroded our ability to cooperate and to collaborate and to coordinate. And so when we have now planetary level problems, it is very difficult to solve these things if we don't have that ability to cooperate and coordinate. And that's really what this is all about. So when I listen to how really these Herculean efforts of trying to make sense between the data and information, not just in terms of data integrity, authenticity, and veracity, but also in terms of what's the knowledge that comes up, what to do next, what are the actionable information that needs to come across. It is clear that it will have to be blockchain and to Jose's last point is that in this, and I always say the killer app that we're saying, what is the killer app for blockchain? It's AI. AI is the killer app for blockchain. And I had a recent talk in London at the Royal College where, the same podium where there was Isaac Newton. And I gave a talk about blockchain AI. That blockchain almost is not a technology, it's an action. It's like, it's a verb. When I blockchain something, it's like I put features on that data. A lot of it, what Jose talked about. Others is, for example, to attribute value to it, and that value can change the way we behave. It can create different dynamics. So suddenly it's not just about interoperability, but it's about intercooperability. And how do we create new business models to actually incentivize everybody to work together? So I think that when we go into this digital world with a digital economy, what we like to use this umbrella term called Web 3.0 is really that it would be blockchain and the whole decentralized scientific movement is part of that Web3 movement that is happening upon us.
Okay, that fantastic segue to Dr. Sehgal for some questions, because you're talking about, if Jose got us focused on, scalable trust across actors with agendas, you're calling out how that infrastructure results in changed behavior, right? So we're talking about incentive change. And that's a big part of DeSci efforts, right? Is kind of addressing incentive gaps with Web3 powered new incentive models, whether it's problems of kind of underrepresentation of the right diverse groups in clinical trials, whether it's a lack of funding for certain non-super blockbuster pharma targets. So in that world, for the audience, I'll just say briefly, Neil Sehgal, now professor at University of Washington. We got to know each other working on some clinical trials when he was at the University of Maryland, and Remedy provided infrastructure for those trials. And actually, it's public, right? There's been press releases. So Vitalik's Balby Foundation is funding germicidal ultraviolet trials that University of Maryland, and Neil is one of the PIs on that we're working together on. But Neil is one of the, almost 10 years ago, along with all these other esteemed faculty in the Bay Area, and I think you were still, for working on a PhD, helped found the University of California, San Francisco's Center for Digital Health, one of the first in the world. And he continues to be both a digital health thought leader, researcher, and expert on health and research ethics. And this is where I now want to sort of invite the broader community as we begin to think about operationalizing the ethos that patients ought to control their data, and if someone makes money off of it, they should get cut in, or have rights that get tracked over time via IP, NFTs, etc. There are things that I believe are not talked about often enough in the DeSci community around ethics implications of this, right? Of incentives, right? So I want to ask Neil for your thoughts on things that the emerging DeSci movement ought to consider and think about how to operationalize in terms of consenting, in terms of permissions management, when there are versions of cutting patients into the ecosystem that frankly can be exploitative and can in my view incentivize someone to even harm themselves to pay rent if I can make enough data monetization off of it, right? So please, we'd love to hear your thoughts, Neil.
Yeah, thank you, Jason. So to take a step back, I think from those overriding ethics concerns, I think it's helpful to think about like how science was done when like Dr. Cahana and I trained. There was a time where like the scientific community was really motivated by scarcity, and that scarcity drove efficiency, right? When HHS was the big funder of scientific discovery, and NSF in the US and similar agencies in the EU we were really obsessively concerned with like making the most of these limited resources that we had. And so we reacted, I think, to build these structures that were responsive to scarcity via efficiency. I think what's really interesting is that that notion that we couldn't allow our reach to exceed our grasp no longer really holds. I think with distributed computing, we can really like reach much further than we could have even anticipated a decade ago. And so we have to cognitively shift in the sort of more institutionalized world that does science to think beyond scarcity. And that is a really difficult cognitive shift. I think on the patient and the participant side, the opposite is true. Right. And that this is where, Jason, when you talk about, you're suggesting pernicious incentives for participating in research, right? We're entering this phase now where on the research participant side, it's not simply somebody who has a rare disease, right, or access to a healthcare institution that can participate. By democratizing access to research and science and participating in science, we've opened that up to folks globally. And there's a challenge innate in that, and that is there's the possibility for scientific discovery and like the sort of the industry around that to move it into the territory of potential coercion, right? By making research global, the relative significance of the incentives to participate in research can really vary tremendously. And I think that this is particularly problematic when we think about how institutionalized or how existing research institutions sort of can eke into that space of decentralized science. And so, you know, when we think about research ethics and we think about bioethics, we're really talking about like four imperatives. When we think about things like respect for autonomy, which the DeSci community is now managing in really interesting and innovative ways, right? Like managing consent. Your data lake in the EU has a really novel strategy, not just to obtain consent, but to assist legacy institutions in moving in the direction of persistent digital consent, right? And that's a novel solution to one of the pernicious problems. Yeah, we're concerned about things like beneficence and non-maleficence, right? Like balancing risks and benefits and doing no harm. And those are things that we need to address as well in the DeSci community to try to think about, well, when you've made science not something that happens where I'm sitting in the Med Center at the University of Washington right now, but can happen anywhere. Certainly the innovation around that is a good thing, right? But we're no longer in the ivory tower and institutions policing themselves. And so thinking about how we balance risks and benefits and how we ensure that the science that we are doing really doesn't pose harm to participants is a really important thing. And the other principle we think about is justice. And I think the distributive nature of decentralized science, in large part, in expression of justice and bringing justice to science. And so, you know, when we think about involving participants and patients and people with rare diseases in persistent science, I think the things that we need to think about are how we ensure that, you know, we're not being coercive and how we are ensuring that by participating in research, we are truly benefiting individuals. And I'll be honest, we've solved some of these problems well. And I think we've put off solving others. And so, you know, thinking about how you manage the pernicious incentives, how you manage things like potential coercion, I think are that next thing for us as a community to solve responsibly. I will say, and this is in no way a plug, but I think the way that we manage that is by reliance on a trusted third party, right? And I think that those institutions, and actually, you know, what Dr. Cahana expressed really eloquently about this deficit of trust that we're experiencing, not just scientifically, but personally and globally, right? We do need institutions to manage these issues of trust. They're just not the institutions that we have today. So things like managing rights, things like managing revocation of consent, for instance, like Data Lake can do. Things like managing revenues while still preserving confidentiality, right? I think we do need institutions and we need to put our trust collectively in them, but they're not the institutions that we have today.
That's a fantastic set of comments. And I'm going to throw one question out at all of you. And feel free, any of you, to to pick it up, and then we'll turn to the audience if they have any they'd like to ask. Implicit in what all of you are saying, but particular Doctors Cahana and Sehgal, around sort of both sort of consent and trust and information, is a very classic liberal conception of information, and then I autonomously make a decision that is the legal framework for today's social media landscape, and all of the misinformation, manipulability of sub-communities, echo chambers, and so forth, right? So I invite any of you to reflect on and to share thoughts on, potential for scientific versions of that, which we saw some of in COVID, with lack of trust in the traditional scientific institutions, and then online organizing around alternative potential therapies, some of which have, after NIH or other funded large-scale studies, proven to be somewhat effective, especially when you couldn't afford expensive remdesivir or whatever. Many of which proved not to. But the one thing I reflect on when the legal framework is based on the anthropological ontology, that is the same that we have for today's social media world, and all the manipulation, and boy, does science is, especially bioscience, it's trillions of dollars a year, right? So there's plenty of commercial incentive for entities to try and manipulate sub-entities, right? And we can just imagine, not tomorrow, but 20, 30 years from now, if we have big ecosystems of DAOs and communities, self-organized, etc. Thoughts on essentially the scientific equivalent of what we see with today's X/Twitter or Facebook or Instagram, and all the political implications of that, which get back to what all three of you are saying, which is the public at the end of the day, they're not trusting the way that they did, and maybe shouldn't have, but they did 20 years ago.
So with permission, I'll start giving a first jab at it, because I think that, at least from my perspective, the mistrust, or the origin of the mistrust, is not really a technology question. I don't think that people really stay awake at night, except, of course, those who, like Jose and Neil, are custodians of that data. It's not the pristineness or the integrity of the data that keeps people awake at night. I think, to your point, is that because we don't trust the game, because there are all these hidden incentives to not tell me the truth or to manipulate the information, that's where the mistrust is coming. So it's in the heuristics more than just the data itself. And I think that this is why it's important to talk about not only self-sovereignty, but also talk about tokenization and the inclusion of individuals in the economic activity of that data, so that they will feel part of it and not in this extractive, exploitative, exclusionary business model. Because I would say, well, of course the pharma company wants me to believe this because they want me to consume their whatever. So we need to transform the system from and you heard me, Jason, say this many times, from a consumption model, a test for every pest, a pill for every ill, the more the better, built on data asymmetries, built on friction and multiple intermediaries, to transform them and to transform the users into producers of health and wealth. And so we're moving from a patient-centric to actually a patient-driven system, or if you want, citizen-centric or science-centric to scientist-driven system.
Yeah, if I can follow up on that, I will say, and much to the frustration, I think, of folks who are maybe more pioneering in this space, it's not clear that therapeutics resulting from decentralized science can come to market in places like the US and the EU without satisfying, for instance, the Federal Food, Drug, and Cosmetic Act in the US, right? Which mirrors the HHS Common Rule that institutes these core principles of research ethics, right? And if you can't demonstrate that you've satisfied them, then bringing a therapeutic to market, a novel therapeutic, is nigh impossible in a place like the U.S. Similarly, in the EU, the European Charter, right? And so, thinking about how we bring novel therapeutics to market, I mean, in the near term, the market's going to regulate that, because even with scientific discovery, if you can't demonstrate that your discovery is built on sort of a foundation of the principles of the ethical conduct of research, it's not clear that you'll have access to markets. I don't know that will persist indefinitely. And certainly, like as synthesizing compounds and commerce becomes more available and more democratic, like that may change. But in the near term, the markets will stifle some of that innovation unless we invest in those institutions to ensure that even DeSci is done in ways that's responsible and ethical, right? And I think that's one of the reasons that it's so important, again, to invest in institutions that mirror those core principles that have us talking about trust and us talking about sort of the relationship between like scientific discovery and democracy, right? But unless we can replicate those, and unless the DeSci community actually can ensure trust fundamentally sort of in its scientific discovery, it's not clear that it'll have access to markets in the near term.
Jose, any final comments?
Yeah, I stayed on because I wanted to hear Dr. Cahana and Dr. Sehgal, and boy, was it worth it. You guys are truly incredible thought leaders. Just kind of one comment. I think that one of the things that you've seen post-COVID, when you look at populations, is a high level of decentralization in the way they behave. There's a lot of craft beer for sale in the United States, as an example. And I think when you start to talk about decentralized science, right, one of the challenges that you're going to run into is understanding what decentralized science is telling you about certain populations, right? You may now be able to apply and understand 50,000 people in San Diego differently than another 25,000 people that live in southern San Diego, compared to northern San Diego. And so you need maximum transparency. And I think to Dr. Siegel's and both Dr. Sehgal and Cahana's points, if you don't have institutions that are built to constantly be kind of looking at that data and interpreting it for a consumer, you're going to create more distrust with decentralized science than you intend, because there are going to be different behaviors that are going to impact population sets differently. So I'm glad that we have two thought leaders like that thinking about that challenge. I've seen it just in deploying blockchain technology in payroll systems. We're talking about people's health, and so I'm gonna leave on that note. It was a real pleasure. And Dr. Sehgal, Dr. Cahana, Dr. Cross, thank you for having me.
Thanks, Jose. And if Neil and Alex can stay on for a couple minutes, I just want to see if anyone in the audience has any questions they'd like to ask.
As someone is ginning up a question, I just want to kind of complete and tag both what Neil and Jose said. It's absolutely right that DeSci cannot be its own movement. And so DeSci, if you wish, has to be part of DeFi. There needs to be a decentralized finance, which has to be part of a DeSoc, which is a decentralized society. So there will be a transition, Jason, to your point of how it's going to be Web 2, 2.5, 2.75, 3. So it's not going to be an on-off, all or nothing. We need to figure out ways of how this social engineering on one hand will stay compliant, but more importantly will fit the market demands that actually are the incentive to really do things. And so without changing the crowdfunding mechanisms, without changing the publication business model, without changing the way scientists interact with their institutes in regard to IP, decentralized science means absolutely nothing. This is not a theoretical exercise of let's move all our databases on distributed ledgers and this will be fine. No, this is just the first step of a recognition of where, in order to reestablish trust, we have to include everybody in the conversation. The reason that we don't trust, again, is not because I feel that, you know, the mean and the median or the Bayesian distribution of whatever was not exact. It's like, I don't feel people asked my opinion. I don't feel consulted. I don't think that this research represents who I am or my community or my needs. And so when I don't feel it, means everything is made in the US on the East Coast or on the West Coast by people who look like me, by definition, that data is garbage. But if I know that there's a transparent mechanism where everything is included, where there's not a gatekeeper. You know, when people say to me, "Oh, Alex, why would I use a DAO? I'm already online. You know, I'm on WhatsApp, I'm on Facebook, I'm on, you know, LinkedIn. Why do I need another?" Because there's no gatekeeper that can shut you down and say, "Oh, your post does not, you know, conform to community guidelines," and so on. And you're like, why am I censored? So the whole DeSci movement, which is a beautiful movement because nobody can argue that the search for truth is not needed. I think that DeSci will be the first step to get eventually to whatever you want to call it, coordinations or Balaji's network states or whatever you want to believe in. But that is the new social engineering in a digital economy, where data as an asset is infinite in its value.
I don't mean to forego any audience questions, but I do just want to say briefly, we have this we have a saying in disparities research: nothing about us without us. Right. I think what DeSci enables is that to become population level, right? Which is truly revolutionary in the way that we think about data and research. But it requires a cognitive shift, not just on the folks who populate the institutions that produce science today, but at the population level, the trust that Alex is talking about.
No, I love it. I love it. Well, guys, thanks so much. Y'all can go to sleep now. We appreciate you from Istanbul, and really great thanks to both of you, doctors. We'll talk soon.
Thank you.
Thanks.
You. My pleasure.